Alright, now myocarditis means exactly what you think it would. Inflammation of the myocardium. Now obviously the inflammation here is a non-specific process, and it's the location of the inflammation that actually gives you your symptoms. If inflammation is in your knee hurts, it gets red, and it's swollen. And if it's in your pleural lining, you get pleuritis, and it hurts to take a deep breath. So what symptoms would you expect if you had inflammation within the heart? Well, you'd expect to see the typical stigmata of cardiac injury, namely chest pain, shortness of breath, tachycardia, and arrhythmias. Now, as I stated earlier, it's the location of the inflammation that gives you the symptoms seen in myocarditis. And although the individual causes may vary, most cases of myocarditis tend to present fairly similarly. And some of the common causes you need to be aware of are included in this table. Of these causes, viral myocarditis may be the most commonly tested. And can you name a few causes of viral myocarditis? Great! Coxsackie B virus, parvovirus B19, and HHV6 are the most common viral causes. And now while we're on it, is the Coxsackie virus an RNA virus or a DNA virus? Awesome job, RNA virus. And which viral family does it belong to? There you go, the picornaviruses. Now while these might be hard to remember, these are easy points on test day, so make sure you brush up on your virology section of the microbiology lectures if you need some review. Now other common causes of myocarditis can be seen here. And some notable ones to mention here include Borrelia burgdorferi, which causes what again? There you go, Lyme disease. And what's the treatment for Lyme disease again? There you go, doxycycline, amoxicillin, or ceftriaxone. Alright, so now we know the treatment, but when do you use each one? Now that's the question you're going to see recurrently on your boards as well as on the wards. So let's break it down. We'll start off with the easiest one, amoxicillin. And you use this one if you're pregnant or you're a child. Next up, we have ceftriaxone, which is only available IV. And if you're giving an IV medication, you likely have a sicker patient. So with that, what are some of the more severe forms of Lyme disease? Great, you nailed it. Lyme disease leading to heart block or Lyme disease causing the cranial nerve 7 palsy. Now, an easy way to think of this is that cardiac or neuro Lyme equals IV treatment, which equals IV ceftriaxone. Now, what about doxycycline? Well, this one is your first line drug, and you use this unless you have one of the situations mentioned above. Now, myocarditis can be a self-limited disease, but at times it can lead to significant morbidity and mortality. Now, some complications of myocarditis include heart block, dilated cardiomyopathy, heart failure, arrhythmias, and a mural thrombus, which can lead to systemic emboli. And now what exactly is a mural thrombus again? Well, it's actually a clot on the wall, usually seen in the left ventricle. And you can see a depiction of this here. So what if you got a question about a 32-year-old healthy male that was found dead at home? The family states that he had an upper respiratory tract infection and had been running a fever several days prior. They also report that earlier that day, he stated that he had palpitations. In this case, what would you be thinking? Great, that he had a viral myocarditis, which set off an arrhythmia and led to sudden cardiac death. In this case, you need to know that myocarditis is a major cause of sudden cardiac death in adults under 40.